Hello, everyone. I'm excited to be with you again today. I'm actually here at Total Care Dental today. I'm in one of our new patient suites. We just got this finished. It's so exciting for me. This is where the patient sits. That's the area they sit. And then we all look together at the CT scan, do a thing together here. Anyway, we just got these up and going about 2 weeks ago. We've been using other rooms and now we have our own new patient suite. Really exciting. But I wanted to tell you a little bit of an update here on what we do when it comes to virtual new patients. For quite a while, I've been offering virtual new patient exams. What I do is I have you go and get a CT scan elsewhere, and then they send that to our office. I look at that, I do a read and look at everything that I can on that scan and then present a treatment plan. And the idea is it helps people to know exactly what they have, what they're looking at, but also if they want to come here for care, it speeds up the treatment. The idea of it was awesome. And I did it for a few years. And, we really had a lot of people that loved that option, but there were some problems with that option. What we found is that a few different things, honestly. First of all, I just can't see everything on an x-ray. There's just no way to see everything that needs to really be factored into a treatment plan just looking at the CT scan. There's a lot. I can learn a lot from it, but not everything. There was an example just recently. I had a woman from California that had come and she had an infected root canal tooth right here in the front, had it removed and had an implant placed. The implant then failed. And we didn't know why. She's in California. It's difficult for her to get back and forth. So I actually found a practitioner in California that I know very well. I sent her there to just have some temporary things done. And that practitioner said, oh, it's because it's so tight. Like her bite is so tight. Well, I never had a chance to actually see her in person. So I didn't know anything about the bite. And I said, you know what? I'm not doing anybody any favors by shortcutting plans and by not seeing all of the story before we're moving forward with treatment. So now if you want to come here and see us, if you want us to evaluate a CT scan, basically you come here. We take a CT scan here, we evaluate it, and we try to fast track as much as we can for treatment for you. But really the key is get here, allow us to see what's happening, allow us to put all the pieces in place. We have care meetings every week with all of our doctors where we do a huge board and everybody brings their own diagnoses and their own ideas and we learn from each other and we create a real comprehensive plan. I can't do that off of it, just an x-ray. So we're no longer able to do virtual consultations here at Total Care Dental. For that reason, I'm just not taking care of patients well enough, not looking at everything, not seeing everything that I need to be able to really do a good job of care when I just have the x-ray. So that's why. So a lot of people have been asking us, and that's the reason why we're no longer doing that. So just come here and see us, or go to the directory. Go to the directory at livingwellwithdrmichelle.com. We're trying to fill that up and get as many doctors on there as we can that are vetted and doctors that can provide the same kind of care. That's really, a great solution for you is to go into that directory and find somebody that's closer to home or come and see us. Either way, we'd love to have you. All right, let's dive into some questions. I have to be done right at 11:30 today. So we're going to jump into these questions. Well, first question, how can I find a doctor like you in Georgia? We hear this so often. The answer is exactly what I just said, the directory on livingwellwithdrmichelle.com. So go there, check it out. If you don't see a doctor there, then please do your own research, send them our way. We would love to recruit as many doctors as we can to be on there. Is there a lot of radiation involved in a CT cone beam scan? That's a great question. And I get that question a lot. The answer is not nearly as much as a regular CT scan. So it's nowhere near the same vicinity, and everything is done digitally now as well. So much less radiation when we do digital radiography. Is there some radiation? Absolutely. There's going to be radiation. It's an x-ray. It goes all the way around your head. It's equal to about 2 hours in the sun. So we do a few things to help with that radiation. We give you vitamin E, it's called tocotrienols. It helps. It's an antioxidant. It helps to calm down the reaction of that radiation in the body. We also have some homeopathics we can recommend that you can do for that as well. So a lot of things to help mitigate it. Honestly, it's worth it. It's worth that to find out what we learn in those cone beam CT scans. Sometimes you have to kind of weigh things. What's the risk versus the reward? There's enough reward in this situation, and we can help mitigate the risk. How do you prevent candida of the tongue and yeast buildups? All right, so let's talk about this, candida of the tongue. When I was younger, I would get a lot of splotches and things all over my tongue, and my tongue was quite sore. I learned that it was called geographic tongue. When I was in dental school, I learned about this thing called geographic tongue. And interestingly enough, everybody tells you we don't know what causes geographic tongue. Well, from my own personal experience, I believe I do know what causes geographic tongue, or a large portion of what causes it, because as I was practicing, somebody introduced me to the idea of tongue scraping. I'd never heard of it before. I didn't even know what it was. And I thought, well, if I'm going to talk to my patients about it, I better try it myself. So I started scraping my tongue, and my tongue was sore at first, really sore at first, but I just persisted because of all the junk coming off. I'd scrape it and I think, this is disgusting. That's in my mouth. I want to scrape that off. So I kept at it. And what happened is all of those patches and things on my tongue went away. They have only come back one time during pregnancy. So what I believe that the large portion of the geographic tongue issues, sour tongue issues, white tongue, a lot of those things are actually fungal based. They're candida, they're yeasts. So when you're scraping your tongue, you're helping to clean that and eradicate it and make it so it doesn't establish there in the tongue. So what do? That's the number one key, is you need to use a tongue scraper. I love the one that I now have on the site. Check it out. It's a copper tongue scraper. Why? Copper is antimicrobial. So you can use it every single day. You use it, you rinse it, you use it again until nothing comes off. And I'm finding when I'm using the copper one that it's actually getting even better results than I was getting with a plastic one I was using for years and years and years. The second thing I do is I always follow that with a mouth rinse, because colloidal silver is it's a very good antifungal. It's very good at killing yeasts. And colloidal silver is the base of the mouth rinse. So you're going to scrape the tongue and then you're going to rinse with it. And it should help a ton with any fungus in the mouth. The other key you need to think about is really backing off on antibacterial things, for sure an antibiotic, but anything that's antibacterial as well, you want to back off on. Otherwise, it kills off bacteria and the yeasts start to flourish. The third thing that nobody likes to hear is slow down on sugar. Yeasts love sugar. And yeasts also, just yeast breads, yeast in things. That goes to the same for ferments. It's in kombucha, it's in beer, it's in other ferments as well. So if you want to calm the yeasts down, don't keep consuming more of them. So stop yeast, stop sugar. I had jaw surgery when I was a teenager, and I have titanium screws in my face. Can that be contributing to health issues? And is there a test you can take for titanium? Okay, so this is a challenge. Had jaw surgery, so there's oftentimes lower jaw surgery, you'll have screws here. Upper jaw surgery, you'll have screws here. We see the craziest things on cone beam CT scans from post-jaw surgery. The trouble is they're extremely hard to access. So I have a brother who's an oral surgeon, and I said, what is it like to go back and get those screws out? And he said, nearly impossible. It's super invasive to try and get back into those spots and get to them. There is a test that you can do called the Melisa test. It's spelled like Melissa, but it's pronounced Melisa, that will show if you have a titanium allergy. So if you have a titanium allergy, take the Melisa test. And if you find that that is the case for you and that's contributing to your health situation, then it's probably worth the invasive surgery to get the screws out. Again, risk versus reward. Find out if the risk is big enough or the reward is big enough to justify the risk of it. So that's the place that I would start. How can I help heal an implant that's been infected on and off? About to get a new crown and have had Lanap done twice. Would love your input. Okay, so what Lanap is it's laser assisted perio, basically. So it's gum treatment done with a laser. If that's already been done on the implant, and if it's been infected on and off, you know what? Most likely there's not going to be something that's going to help save that implant in the long term. You've already done a lot of treatment. You've already done a lot of things. I don't think I would get a new crown on that, because that's putting more money into probably a sinking ship. Most likely what is going to happen is you're going to end up losing that implant, unfortunately. I hate to tell people that, but unfortunately. In our hands here, our surgeon is extremely proficient at bone grafting, and he probably would give it a try. He would open that whole implant side up. He would clean. The problem is there's threads on an implant. So once bacteria get onto that implant, they just take the slide down and follow those threads down and get underneath the bone very easily. So he would go and clean all of those threads. He would bone graft right up to the side of the implant to give it one last shot. And that's probably what you can do, one last shot. But it may be that you're actually going to lose that implant, unfortunately. Do you ever say it's okay to do a root canal? I just had an old root canal extracted, and I don't want to do that again to a live tooth. So your question actually brings the answer with it. I don't want to do that to a live tooth. The key is keep the tooth alive. As long as the tooth is alive, you're not looking at the choice between a root canal and removing a tooth. You're not doing that at all. Keeping the tooth alive is key. So how do you keep teeth alive? Well, number one, you make sure they have lots of nutrients and make sure that you're cleaning them properly. So that's lots of hydroxyapatite, both in the remineralization kit that you can find on my site and the tooth powder and mouth rinse that you can find on my site. Just bombard those things with minerals. The second thing you can do is make sure you're eating a lot of nutrient-rich foods as well, that you're getting a lot in. The third thing to think about is if you do have a deep cavity already, as long as the tooth is still alive, meaning it can still feel things, it's still sensitive to hot and cold, it's still, you still know the tooth's there. As long as that's the case, you can save the tooth. We use ozone on the deepest decay and fill right over top of it and keep the tooth from needing a root canal or removal. So that's the key. Like I said, the answer was right in your question. Keep the tooth alive, and then you never have to do this again. My 6-year-old daughter has just been diagnosed with molar incisal hypomineralization. What can I do? I assume your toothpaste, but what else can help? Okay, so what does this even mean? 6-year-old is if there's a hypoplasia on molars and incisors, so front teeth and back teeth. What that means is sometime during the development of those teeth, typically it affects these teeth right here and the first molars in the mouth. Usually that means that there's been an event around age 2, high heat, so high fevers. So it's going to be strep throat, some sort of infection, ear infection, that kind of thing has led to a high fever. And that heat affected the development of the tooth bud, and it shows up as that on those teeth. The good news is it's not necessarily damage to the tooth. It's just unsightly. Like you just don't love the way it looks, especially on the front ones. So yes, toothpaste, the tooth powder for sure. You want to get a lot of minerals in. You're also going to want to do vitamin D3 and K2. I have a liquid one of that, so kiddos can take it really easily. And then a liquid mineral. And the liquid mineral that I love is actually called, it's from Mother Earth Labs, and it's called humic and fulvic acid. It's basically dirt water is like what I think of it as dirt water, but it just gives the minerals they need. And again, it's in a liquid form, so it's great for kiddos. I would add lots of minerals. Most likely you're going to have to do some sort of a filling over the front ones to make it go away cosmetically, but it isn't necessarily a problem. It just doesn't look great. What is the best toothpaste for a 1-year-old? Absolutely my tooth powder. You can use the citrus flavor, which a lot of times little kiddos like. You don't have to worry about swallowing it. You're going to just dip the wet toothbrush in. You're going to brush, and they can swallow, they can spit, they can do whatever they would like, but it's going to help to keep those teeth healthy. Can root canals cause health issues such as back pain? So root canals can lead to inflammation, and that's what causes things like back pain. That's the key, is the root canal harbors infection, harbors bugs basically 24/7. Well, when bugs are hanging out there 24/7, your body's immune system, alert system goes on high alert and says, whoa, this is a bug, and this bug is never going away. So it sends a bunch of immune cells to that area. Well, immune cells in the area, they start to kill bugs, but there's collateral damage. I literally was just writing this morning in my book. There's collateral damage for all of that immune activity, and it does destroy some of the tissue in the area. It leads to swelling, redness, all those kinds of things. Now, at a low level, you don't get the swelling and redness because you might think, well, I don't have that around my root canal. Absolutely, you don't have that around your root canal, but there's low-level chronic inflammation that never goes away. Eventually, the body's just like, okay, I don't have to send the big guns, but I got to send guns there all the time. We always have to be fighting this. That low-level inflammation leads to inflammation in the rest of the body, back pain, whatever it might be. I just learned that when you have a big acute infection like strep throat, let's say, something like that, what you're going to find is that you have a high level of something called C-reactive protein in your blood. Basically, C-reactive protein is what your liver sends out to say, danger, things are going on, it's not good. And those C-reactive proteins alert the immune system to come attack. They also tag the bad guys and say, these are the guys to kill. So the high C-reactive protein means, high inflammation. So this is a test that doctors will use to determine what's the inflammatory level. In an acute infection, a strep throat, something going on, you're going to see a C-reactive protein level of 1,000. It's going to be really high. In chronic infection, like from a root canal, you're going to see C-reactive protein at about a 3, really low. So you're going to look at that, and a doctor may say, you don't have any problems. There's nothing going on. No big deal here. Well, guess what? Even at a 3 C-reactive protein, it triples your risk for heart disease. So low-level inflammation can be deadly because we ignore it. We pay attention to the strep throat. We ignore the other stuff because it doesn't really hurt the same way. So that's how root canals lead to inflammation and pain in other areas of the body. It just ramps up the inflammatory reaction in the system. What is the best implant to get? Ceramic, titanium, and what screw should I get? So what they're asking is for a dental implant, if you have a tooth that's missing, what is the best option? 100% ceramic. There are very few indications where titanium may be the only option, but ceramic is the material of choice. It's called zirconia. So when you hear that, that's the same thing. You're talking about the exact same thing. I have apical periodontitis in my root canals. It's not causing me pain. Can I do Candid first, then take the root canals out, or take the root canals out and do 7 months of Candid, then implants? Okay, this is the kind of question that we talk about as doctors all the time. So the question is, there's infection at the end of an old root canal, need to have expansion. So something to make more room in the mouth for air, for breathing, probably for sleeping reasons. The question is, do you take the failed root canals first and then do the expansion, or do you do the expansion first and then take the root canals out? The answer is a little bit person dependent. You know, how big is this infection? That kind of thing. If it's low level, if it's been there a long time, we like to do the expansion first. Why? We utilize those teeth to help us move and make space in the mouth for air and breathing and all those things. If the teeth are gone, it's harder to do. It also, we allow space to be able to put implants into those spots. So if the teeth are there, we know exactly where the implants need to go. So preferably expand first, then take root canals out next. We're pushing that off just a little bit, but you have to think, how long have they been there? Probably years. We're pushing it off, like you said, 7 more months. It's going to be okay. I have a crown that just came off after 4 years of having it. I started oil pulling a month ago. Could that be why it came off? That's a great question. People ask this all the time. It absolutely could be why it came off. However, if it was able to come off with the oil pulling, it meant that crown was leaking. The cement seal had been broken and that crown was leaking because that oil was able to get up into there and cause the issue. So if you have a filling fall out or a crown come off because of oil pulling, there was a problem with the filling or crown. So it's an okay thing. Go and get it cleaned and sealed properly now. Can I talk about the common issues I see with wisdom teeth extractions? Can problems turn up years later? And can pregnancy prompt issues to turn up? Okay, so common things that we see in root canal sites, or excuse me, wisdom teeth sites. This happens, and it's not just wisdom teeth, it happens in anywhere a tooth has been removed. So anywhere a tooth was removed, if the ligament was left behind, or if the body was unable to fill that area because it didn't have enough nutrients to use, a lot of different reasons. But if that was not able to heal properly, it leaves a dead zone in the bone. And I joke all the time and say, if you have a gallbladder attack, they don't take your gallbladder out, clean it out, and then put it back in, because we know that dead things cannot exist in the body. Bacteria will find it, it'll get infected. Same thing happens here. When you have a dead zone in the body, dead things can't exist in the body. Bacteria will find it, it'll create an infection in the jawbone, and this is what we see. So with wisdom teeth, we see it affect the endocrine system. That's going to be fatigue levels, thyroid, adrenals, sex hormones, so progesterone, estrogen, testosterone, all those things are going to be very difficult to control if there's infection here. Also, heart is one of the other indicators. Hips, which is interesting, hip pain. Those are some things you're going to see also. And stomach, some digestive issues. So those are common in wisdom teeth. The other teeth that are missing, it's based on the meridian or the other organ system that tooth is connected to. So it may be everything from bladder and gallbladder up front and liver to stomach and large intestine to spleen and small intestine. It just based and breasts here. It's just based on where the tooth is that came out that didn't heal right. Can this exacerbate or get worse in pregnancy? Yes, because the body is working hard to grow a human. And what does it require to grow a human? A lot of minerals. So you're going to be taxed and using all the nutrients, all the minerals. Those infections can flourish and can get worse during that time when your body just has a lot of demand on it. My teen has 2 cavities. Dentists will do resin fillings. Is that okay? Yes, a resin filling is the kind of filling that we do as well. So with 2 cavities in a teenager, that's great. Bridge versus an implant. When would we choose one or the other? So a bridge is where there's a missing tooth and you put a crown on either side of the missing tooth. So you're impacting the other teeth to fix that missing tooth, to replace the missing tooth. You're doing a crown. Now, a crown often will lead to tooth death down the road. So we call it making a 1-tooth problem a 3-tooth problem. So if there's any way possible to do an implant, I recommend it. Otherwise, you are compromising the teeth holding the bridge in a way that may potentially lead to you losing them in the future too. Can root canals cause Hashimoto's? So it's the exact same story we just said. Root canals are going to lead to inflammation in the body. They're going to lead to immune system activation. Immune system activation can lead to autoimmune disease, which is Hashimoto's. So you just have to kind of work backwards. Does it come back to inflammation? It does. There we are. I'm going to jump onto this other thing and see if I got them here. I I had a CT scan of the oral surgeon. Is that the same as a cone beam CT scan? It is. That's exactly the same as a cone beam CT scan. Excellent. I'm getting 2 teeth pulled, failed root canals. What is the best implant? We already said ceramic or zirconia. How do you fix cavities after multiple fixes? This is a challenge. If it's had a multiple cavities, multiple fillings, and it's very large, sometimes we have to do something called an onlay, which is a porcelain top, holds everything together and supports it better than just a filling will do. There's also a Sensiband metal allergy test to test for metal allergies. Okay, so yeah, there's multiple different metal allergy tests. However, the Melisa one is specific for titanium. So if you're looking for titanium, I believe that's the only one that'll really give you an allergy report, not just a sensitivity, but an allergy report to titanium. And I may be wrong on there. I have a failed root canal and it's causing infection. I went to the dentist yesterday and they said it's my choice to have it out or go to an oral surgeon to redo the root canal. It's been really a problem since 2013 and I want to get rid of this infection and release it. Is it best to have it pulled? Okay, so the question is, you have an infected root canal. There's infection already around the root. Have been given an option to redo the root canal or get the tooth removed. Let's talk about the redo. What are they going to do when they redo? Well, the original root canal, they clean out the nerve inside of the tooth, fill it up, disinfect it, and fill it up. The problem is there's little nerve channels that go off of that main canal and they cannot be filled and they cannot be cleaned. It's impossible. So the tooth is unclean. There's dead tissue inside of the tooth. This is why it reinfects. When they redo a root canal, what do? They clean out the main filling material, disinfect it, and fill it back up again. The problem still persists. The same problem is there. There's still tissue stuck in these little side channels. So redoing a root canal may kick the can down the road another year or two because you freshen things up, but it's not going to take care of the underlying problem with root canals. So we always give you the option. Legally, we have to give the option of both of those, but I always recommend, if it were my tooth, I would have it removed because you're taking care of the problem rather than just pushing it further down the road. What teeth are related to causing migraines? You know, migraines are often a muscle issue. A muscle, well, it could be 2 things. It could be muscles, so muscle function based on the bite, the way the teeth are coming together. If you're having distress and strain to get enough air, that will lead to migraines, but mercury will also lead to migraines. So it's less the tooth that's there as what's affecting the tooth. Is there a bite issue, a function issue, or is there mercury in the tooth? Both of those could lead to migraines. All right, back over to here for just a minute. Advantages or disadvantages of an implant versus a removable partial to replace a root canal or crown. All right, so a removable partial is like a retainer with a tooth on it. You know, it's fine, but it's not great. It moves in and out. It gets food underneath it. It eventually loosens up. You have to get them replaced. You're not going to love a partial denture. I tell people that partial dentures fit best in your top drawer, not in your mouth. Because that's where they live most. People are just like, it's just a bother. I'm just not even going to wear it. So usually the implant, always the implant is going to give you a better result. You're going to be able to chew with it. You're going to be able to smile with it. And hopefully it's the last thing you're going to have to do to that spot. It doesn't come in and out. You don't have to clean it differently. So much better if possible. I'll always recommend an implant over a removable partial denture if that's an option for you. Sometimes financially it's not. So a partial denture is a good option in that situation as well. But an implant always gives you just a better result. You're going to be happier with chewing with it. Does a clogged throat every morning mean something is wrong with the airway or reacting to some kind of infection? Often a clogged throat every morning means you've been draining something, right? Draining something. Ugh, yuck. It's most likely an infection in the mouth somewhere, an infected root canal, an infection where teeth were removed, or infection in the nose. Maybe that too. Sometimes there'll be chronic sinus infection that is actually fungal. It's yeast-based, not bacterial-based. So those are all things that can cause that clogging. It also can be caused by a real dry mouth. If you're breathing through your mouth at night, if you're mouth breathing because you can't breathe through your nose properly. So I would just go get a cone beam CT scan and explore, is this an infection or is this an airway issue? Can I talk about Sjogren's and what you tell your patients to use for oral care? So many different options or opinions. Yes, Sjogren's is an autoimmune condition. It's an autoimmune condition that leads to dry everything, right? If you have it, you know, dry everything, dry eyes, dry mouth, dry everything that's supposed to have a little bit of moisture in it. And the challenge with it in the mouth is a dry mouth will lead to tooth decay. So we have to keep your mouth moist. This is when I absolutely 100% recommend my breath spray. It's actually just the mouth rinse in a spray bottle, but you carry it around with you because what it's going to do is, first of all, the colloidal silver is going to kill bugs in there. There's lavender, calendula, a whole bunch of herbals that are actually going to moisten. There's marshmallow root, which is my favorite because it actually stimulates saliva. So marshmallow root moistens, stimulates saliva, but it also has hydroxyapatite. So it's going to help prevent tooth decay. So for Sjogren's, we're going to work basically in the mouth. You're going to hit it with that breath spray as many times a day as you want. And then, of course, tooth powder and mouth rinse, because you want to make sure you're getting as many minerals into the teeth as possible. But the breath spray is portable, so you can take it with you. It's going to relieve a lot of those symptoms you're experiencing every single day. Now, what do you do on a long-term basis? It's autoimmune condition. So what can create an autoimmune condition? Anything that's inflaming or upsetting the immune system. So this could be any sort of infection in the mouth. This could also be an airway or breathing issue. You need to see and get further into what could lead to the autoimmune condition. What root cause is causing your immune system to fight itself. So that's where we go next. I have to clean my 6-year-old teeth regularly with a calculus remover due to tartar buildup. He has now lost his four front baby teeth, upper and lower, and I'm afraid this problem will continue. So tartar buildup is often a calcium metabolism issue. You need to get your son or your 6-year-old on vitamin D3 and K2 supplement. Again, go to the Living Well with Dr. Michelle's site. We have a liquid one that's great for kiddos. And usually when you up the D3 and K2, they metabolize the calcium better and you don't get the buildup like that. That goes for adults too. My son has had an increase of cavities on his baby teeth. I have a feeling it's due to low stomach acid. They want to put a stainless steel filling, which I don't want to do. Can HCl Digest help? It can help. HCl Digest does help with stomach acid. The challenge is it's an adult dosage. That's the challenge with the HCl Digest. It's an adult dosage, and you can't really open it and dump it into water. It burns. So the option that we give is Standard Process. The company called Standard Process has a product called Zypan. Zypan is lower dose of hydrochloric acid, and you can cut it. It's a pill. You can cut it. So I recommend Zypan from Standard Process and cut it to dose down for someone that's younger. That will definitely help. Stainless steel, that's another question you didn't ask, but I'll address it. That stainless steel crown, it is not mercury. I don't love the metal, but it's better than mercury. And because it's temporary in the mouth, the tooth is going to come out. It may be a necessary evil for a few years to get to that tooth being able to come out because it protects the tooth and keeps it in the mouth. So we actually do zirconia crowns even on baby teeth. Maybe look for a dentist that will do that for you. But for sure, try that Zypan from Standard Process. If a dentist offers a filling that is white in color, does that mean it is non-toxic with no mercury? Yes, it does. Also, I just went through breast cancer diagnosis. What is the best route to get any silver out? So you need to find a dentist that's certified through the IAOMT.org. Check that out, IAOMT.org. And they have been taught to do the smart mercury removal technique, which means it's going to be done safely. You do not want to get more mercury into your system. That would be the worst thing you could do right now. So get it out safely. And if they're going to replace it, then they're going to be replacing it with a non-mercury containing resin filling or white filling. Do you ever do a reverse root canal? I have a bottom tooth that my biologic dentist wants to extract because it needs a root canal, which he won't do. What other options are there? There's no such thing as a reverse root canal, unfortunately. I wish that there were, and I wish it were effective. If it were, we would do it every single day, but there's not. So if the tooth is already died, that's the key. Remember, if the tooth is already dead, then the options are going to be a root canal or removal. I'm with your biologic dentist and that we don't do root canals here. I always offer it. And if people want to go to a specialist and have that done, they can. But we see that there's usually long-term effect of that. Maybe it's okay for the moment. I will tell you though, bottom front tooth is a fairly easy one to replace. So it may be an okay choice to have that one removed and replaced. All right, 2 more minutes. Can you fix a tooth with your toothpaste if it moves? I'm not quite sure. I don't believe that we cannot move teeth with the tooth powder. Unfortunately, I wish we could. That would be really awesome. We cannot move them or we cannot move them back somewhere. However, we do have a really great clear aligner system called Candid. It's like Invisalign, but it actually is clearer and we love the way it works. We use that to move teeth. What is the best way to determine if I need to take fillings out for non-toxic ones? 2 years out from breast cancer diagnosis. Keep hearing the connection to oral health. The connection to oral health is enormous, especially for breast cancer diagnosis. If you have anything on these teeth right here, these teeth halfway back, not the molars, not the front ones, but the ones in between called bicuspids. Those are directly related to the breasts. So if you have something in those teeth, absolutely get it out, but please get it out safely. That is so important. I found out I have 22 cavities right now. Some are being washed and 8 of them need fillings. Should I wait a few months and use your tooth powder before I get them filled? This is really something that's important to ask and understand. Filling the cavities that are in the outside layer of the teeth, and the enamel are ones that are going to be repaired by the tooth powder. Those are the 12 or whatever it is that you have that, or 14 that you have that they are watching. Those are the ones that are still in the enamel. Absolutely use a tooth powder for those. The 8 that need to get filled right now need to get filled right now because the cavity has progressed to the inside layer of the tooth. Tooth powder is not enough to fix those. So get those 8 fixed and then use tooth powder and mouth rinse like crazy. Even after you brush, get some tooth powder, make a paste and rub it everywhere just to see if you can get as many minerals in your teeth as you can, and the full remineralization kit, the vitamin D and K and the tooth and bone formula. Get minerals in and see if you can save the rest of those teeth. All right, everyone. Thank you so much. Amazing questions as always. We'll keep doing this. I'll be back here at 11 o'clock next Thursday. Thank you all.